this opportunity to come here and listen to what's going on in Kenya and what we can do for our fellow Kenyans. We want to thank you, Father, for these great friends, Kenyans and all the friends of Kenya, for making this event happen. Even as we think about diaspora, we think about our country, think about our development of our country and empowering our people. We want to thank you, ask you, Fathers, everything you're going to do today, be with us. All the presenters, we want to thank you for them and the presentations they're going to make, and others who are attending and those who are on the way coming. We ask you to fasten their feet so they can get to this event. We want to thank you in the name of the Father, the Son, and the Holy Spirit. Amen.
Good morning. Are you excited?
Yes.
I am. It's a good day. It's going to be a good day. So we've honored God for the day. Thank you, God. And now we honor our country. So we'll do the national anthems.
Yesterday we spent a lot of time doing pretty much an introduction of this conference is all about. Today we're going to delve a little bit more into it in terms of presentations from our sponsors and those that have talking about our businesses and the opportunities that are available for us in the diaspora. And also we get to share ideas from those of us that want to engage with the businesses themselves, see what those synergies are that we can collaborate on. Some of the things that actually we learned from yesterday, for example, is how to invest in real estate in Kenya. Shortly we'll be hearing from Jonathan Jackson, who will be telling you, he said yesterday, want to know what the experiences are from our standpoint, what it is that we can do to help invest in that market that is emerging. Real estate is actually hot in Kenya right now as we speak, so we want to see what those opportunities are. On our end, you're going to be hearing from the from politics. That's going to be something I'll be talking about. You're going to be hearing about healthcare, some of the opportunities that are available.
But as we've been told today, we'll really try to have a good day with the presentations, try to listen to our sponsors, see what they have for us today. But I'm going to start talking about the healthcare project. Okay, so what we're going to start with is just get the day going. And to start the day going, as I said yesterday, I'm in the healthcare industry in the United States of America, serve the patients in America, but I have a passion for my country. I have a very special passion for Kenya. So what happened, or has happened within the last few years and months, I've decided to serve back in Kenya and to give back to my country. So last year, it's actually not last year, this year in January, a group of us set out to go to Kenya and serve our people in Kenya. And what I want to share with you now, it's the project that we worked on. Okay, so after seeing healthcare in the United States of America and knowing what it looks like in Kenya, because I grew up in Kenya. I moved into America when I was an adult. I grew up in a village in Kenya, I did not grow up in city. I experienced life in the city after I was 12 years old. So for my first 12 years of life, I knew nothing but the village. And I teach here in the United States of America. And sometimes when I talk about my home country, I say some of those pictures that you see up there, that's me. Those children you see footless, that's me. A couple years ago, that's who I was. That's how I walked. But there is an opportunity to make a change. And I'm going to show you that I think there is an opportunity to make a change in Kenya. And the question, the burning question for me is, does the diaspora have a responsibility? Do we really have a responsibility to our home country? And if we do have a responsibility to our home country, the question is, what is holding us back? What's the problem? Can we get to the core of the issue and try to make that change? So last year, I remember being called to a meeting of a few people who were planning a trip to Kenya. I did not understand how that was going to be. Actually, I remember talking to one of the leaders in that group one day, Lucy, and saying, if we go, if we make it, and she said, what do you mean if? We're making it. And that kind of woke me up and said, yes, we are going. So we planned to go to Kenya, and I love Kenya, I love my government, I love my leaders as people. And they are trying to do something that perhaps we need to understand. So I'll share this.
Very sad tales that we hear and read about or see and watch on TV about our people who are suffering just because they can't access this equipment. I really think this in itself is a major transformation of the manner in which we provide.
Very sophisticated machinery. And we have been told that we have 96 level 4 and level 5 referral hospitals. What that means, we have a first-class trauma center that if somebody is hit by that boda, we can rush them to the hospital. They will find very well-trained trauma physicians, very well-trained nurses, and they will be taken care of and go home. With that kind of machinery, that looks like my hospital in South Bend. But a little while ago, we went home.
We can't hear you.
Sorry. Now? Okay, so a little while ago, we went home, and I had a family member who needed to go to the hospital. I accompanied the team that took him to the hospital. I saw 3 people sharing a bed in a hospital. And these people have different types of diseases. You have somebody with a wound. You have somebody who broke their hip and they're sharing a bed. These people, there's no dignity. That's simply what it meant. And that was a level, I want to say 4 hospital, according to the classification. So that kind of worried me. But worrying me is not enough. Can I do something? Can the diaspora make a difference? And if we can make a difference, what's holding us again? Because there's a world waiting for us out there. And they actually believe we got it right and we can help them. So we need, and my colleague is going to talk more about our health here, because like we were saying yesterday, we need healthy people. If we are going to run the businesses, we need to be healthy. If we are going to be the engineers, we need to be healthy. Because that's the backbone of what we do. So this team that went to Kenya, we thought outside the box. And said, we'll go to Kenya, we'll try and make the difference. So I call it a group of brave 4, because it was a very small group. It was not led by a multitude. We had 4 people who came together and decided to go and serve in Kenya and make that difference. Meetings were held. We never had met. The people that took that medical mission to Kenya, I never knew them. We met in Kenya. But we met over the phone, we planned, and we decided to go. That was Charles Mutunga, Engineer Charles Mutunga, Dr. Lucy Kibe, Ralph Kilondu. That was the team that came together and decided, let's go and do this work. Let's go and do it. And of course, we got support for our dear Americans. There was Rosemary. Rosemary is not here. Taisha is here. Taisha, can you stand up? I would like for us to clap for you, please. Taisha got on the trip, and she did a lot of work. She did a lot of groundwork, and we worked endless days. Endlessly, people was working, and Taisha was there, checking blood pressures, checking blood glucose, and just making sure everything ran right. So we had Taisha, Sharon could not come, and Laura could not come. Those were our 4 supporters who came and helped us. And of course, we collaborated with the government. And we learned a lot, which you will learn a lot anytime you're doing something with a team there. So, as you can see, we had support from the government, security came out, the ministry, I think there's probably too much lighting for you to see. This is the Minister of Health in Machakos. She came, and she came with the security, and they helped us. They helped us in as much as they could do. So we appreciated their help. So we went to Nakuru, and Nakuru, I don't have the exact data of what happened in Nakuru. Lucy had the data, so I'll skip the Nakuru data. We went to Mitaboni. That's an area in Machakos. We went to Mitaboni, We were there for 2 days, 16th and 17th of January. We had 2 medical camp days, and it was officially launched by the Minister of Health in Machakos. So that was the camp when we went in Itaboni. They came. And you know, this is where I get excited. It's not in the trip, it's not in the collecting the money, but it's in serving them, providing to them, showing them there's a better way of doing things the way we do. So they came, and every day looked like that at all the camps that we went. So in Mitaboni, this is a breakdown of the data. We got a report from the health officers because they were keeping data of what we were doing. Ear, nose, and throat, we saw 87 people. Eye problem, 330 people. And what had happened in preparing for the trip, we collected glasses from America. We had a glass raising fund, it's not a glass raising. And we had people give us their glasses that they don't use, and the dentists in Kenya, they knew how to match them. Not the dentist, the ophthalmologist in Kenya knew how to match these glasses to the right people. So we saw 330 people in Mitaboni. Dental, we had a dentist who came with us. He had his equipment. He saw 330 people, 226. We were doing cervical cancer screening, 112 screenings, upper respiratory infections, 259, a lot of diarrhea, blood pressure. Thank God it's not as prevalent, but it was there. We saw some people with really, really serious blood pressures. Diabetes, not as bad as we would see here, but there were people with diabetes. And that was just in Mitaboni. So we went to Chawango. Chawango, that's my home village. That's my dear place. We took the camp to Chawango. Again, people camp. It looked just like you saw in the slide. We started at 10 in the morning, closed up about 6 p.m. Rain was coming up and we had to leave because that place is so far away. If you get caught up there in the night and it rains, you are not making it home. So we had to close up and go home. But we saw a total of 648 people, patients. I don't want to call them patients or clients. They were village people. They came out because they knew we were coming. And of the 648, 21 were children. And this is the official report we got from the Ministry of Health breakdown. So 648 people came, 21 of whom were children. And this is what happened in Chawango. The dentist saw 80 people, did 70 tooth extractions. Because we have people sitting at home with abscesses, with bad cavities, they have pain. He extracted 70. He did 70 extractions. Eye problems, 254. Number of people diagnosed with cataracts, 17. That is quite an interesting number. 67 cervical cancer were screened. And then I think this is a very important part of the lesson, what we learned. And this is coming from the health department in Kenya. So they are saying we can work together. Looking at the number of people diagnosed with the dental and eye problems, because of that trip, there's an urge for the government to send these specialists to the village. Because there's none. There's not a dentist. There's nobody who looks at people's eyes. So people are going blind, people are losing their sight, and they are working with teeth that could be prepared. So that was a very big lesson that we learned. And we learned we need to continue to do this work. We need to continue to promote this work. Not only in Mitaboni, not only in Machakos, not only in Nakuru, but we want to go to the whole Kenya. So soon we want to go to Kisumu, we want to go to Kwale, we want to go everywhere. Because as we saw that crowd, we know they are everywhere. But how do we do this? We have to be goal-driven. We have to know what we want to do. We want to make a change. Focus on outcomes. We don't want to just go there and say, oh, here we are, we did some work. We want to see, what do we do? Like, we want a report. What do the local people think? What have we done? Again, like I said, concern for the whole country, not just one little sector, making that difference. But we have to work as a team. Work as a team. Work as a team. And then this slide, this is what I did not tell you about the whole thing. It takes a lot of work to take the trip home. We did a lot of time volunteering. We did a lot of our own money contributing. We had a lot of fundraising events. Our American friends helped us. They had dinners. We had comedy shows. We did whatever we had to do. Because when we went on the trip, we had medication. We provided medication for the trip. We wanted to make sure if somebody comes in and they need antibiotics, it's there. If they come up and they have high blood pressure, they have medication. Why would we know you have blood pressure and we are not doing anything about it? So we were prepared to provide that. And this is very important because I think we as a community need to know that we need to come together and contribute to help our people at home. There's a need at home. We can do it. Like I said, I do believe and I know we have the capacity. It's just turning on that key and being able to move forward and do what we need to do for our people at home. And this, just give me, oh, there you are. This is Lucy's project. Lucy introduced us to this trip to Kenya because she had done it in 2011. That's Lucy who told me, we are going. And I thought, okay, no doubts, we are going. And from that day on, I was not talking of if we do. I was saying, okay, we're doing it. But this is what Lucy had done, and this is what really inspired us.
Don't get it twisted, love's a beautiful thing. Stop chasing, game! Come! I'm gonna also want to make a first call. When you go home and start falling in love. You don't see what I don't ask her.
Okay. She truly made me fall in love with my work. So that's our presentation to Kenya. That's what we did, and our hope is we continue to do this, but we cannot do it alone. I tell you, we cannot do it alone. They are there, they are waiting, they are ready. Yeah, we got just a couple of slides we want to share with you here. Okay, while she's getting the slides, do you guys have any questions at all?
I have two.
Yes.
I have two and a comment.
Yes.
Two questions I have is when it comes to cervical screening
Yes.
and prostate screening.
Yes.
With with our traditions, those are things that people don't talk about. So how do you overcome the introduction of those screenings in such an intimate setting?
Absolutely. And that's a good question because, yes, we do have very strong cultural beliefs about certain, like cervical screening and prostate. And that's where we need to continue the education of our people to know we've been brought up in a certain way. We've been brought up to believe in a lot of privacy. But there's a lot of disease that can come from places that we don't talk about. So education, education, education. The people that we screened, we had midwives, we had doctors who worked with us in Kenya, and they were told the reasoning behind the screening, and they did it willingly. So we just need to continue education to change the minds of the people.
And just another question or a comment. What about HIV and STD?
Yes, we had somebody who came in, we had officials who came to screen for HIV, and as you saw in Chawango, they screened a number of people and none of them had HIV, thank God. So again, talking about these issues, yeah.
And then now my comment. I'm sorry. But I was born in Yale, at the General Hospital in Yale. And for me, it's I think a very emotional thing when I talk about the labor and delivery wards in our hospital. I mean, that's a place where life begins. And they're the most, try not to get emotional, but they're the most, how can I put it? Your dignity in those places are it's very low. I mean, for a woman, like you said, sharing a bed, some of them coming without supplies to bring their child into the school. And then I had the fortune of having my children here and seeing the way, as a mother in labor and delivery, the way they take care of you. It's almost like I felt guilty, you know. So one of the projects, God willing, and I will do, I honestly believe we need to come up with a kit that has the sterile scissors and all the I should call it a labor and delivery kit that a patient that we can distribute to these low-income maternity wards. And then also a gift, the gift bags that we get here.
Yeah.
Just, something like a onesie or something to make that mother feel that you are appreciated and that life, it has meaning.
Yes. And these are the good ideas that we need from all of us, because like I said, we can't do it alone. I might be an expert in being able to actually deliver the care. We might have an expert who knows the logistics, and we might have an expert who knows where to get that from. So we need everybody. We need sponsors, we need supporters, we need everybody. Okay, yes.
I have a quick question about the medications. Do you buy them here or are they donated? How do you get the medications?
Kudos to Lucy, because she had that thought out. We did not buy them here.
You bought them in Kenya?
I'm going to let Lucy answer to that.
I'm going to answer that as part of my presentation.
What about the eyeglasses?
I'm going to answer that. I have a short presentation. I'll tell you a little bit about the logistics. Did you have anything else? Or is it my time?
It is your
time. Before you go,
Yes.
I want to call everybody who went on this trip to Kenya here, because Juliana and I are presenting, but really it was a team effort. Come on, Taisha. Let's make it quick. Charles, come on up here. I want to introduce you to these people because these are super, super special people. I could not have done this. Charles talks over, and maybe at some point today he can tell us about the levels of levels of
life. These are levels of life. I can judge of that.
Yeah. Well, maybe he can. Maybe don't know during your own time. But I want to introduce you to these very special people. These people give thousands of dollars from their own pockets to go and help people that are not even from their villages. I'll tell you a little bit about how this thing started, but and I get very excited when I talk about this, so excuse me, plus I also had a cup of coffee. But I have never found people that are this giving. And let me just take like 30 seconds to tell you about each of them. Juliana here, she's an angel sent from God. This woman, she will do anything for her people back home. Anything. She will sacrifice her life for them. We all love where we come from. But Juliana super loves where she comes from. And she helped to collect a lot of things, to coordinate a lot of things, get a lot of donations. most of the eyeglasses, which we just did a drive, we had flyers, we put them up, and we said, and we put little boxes and said, drop your old glasses here. And we got lots of them. And Juliana headed that at her school. And she really helped to coordinate all this stuff. So let's give a hand, a big hand to her. Charles here was our chairman. He actually went to Kenya a few weeks before we went. He left his work, he left his family, he went to Kenya so he could make sure that everything was set. This man gave a lot of money for this project. You see all those people that we saw? A lot of lives were saved because of what he gave. So thank you, we really appreciate it. I don't know what to say about Taisha here. Taisha here is my sister from another mother. Taisha, we met not too long ago, 2-3 years ago. We worked together, and I started talking about this trip that I'm going to make, and from the very first day she said, I'm coming with you. And she organized a comedy show, invited people from the neighborhood, worked so hard to raise money for this trip, then gave her own money, then took time and left her kids to go to a foreign land where she knows nobody. It was the first time she was getting on an airplane, and she struggled on the airplane. She can tell you stories about that. But I don't know if I was told to go to Timbuktu and help somebody that I don't know, who I have no connection with, and give my money to do that, and my time, and leave my kids. I really don't know if I can do that. So it takes a very special person to do that. And while I'm talking about Aisha, I'm going to recognize Bonita as well. Bonita also works with us from Philadelphia. These two girls, they flew here. They flew here to come and be with us, sit with us, and listen to all this Kenya stuff that they know nothing about, just so that they can support us and do some blood pressures maybe later on today. This is really special. Let's give a hand to Taisha. Rafi is another brother from another mother here. Ralph is actually the one who connected me to this team. We just met when he was doing his soccer work, and I told him what I do, and he was like, I know the person. And so he connected me with Charles, who connected with Juliana, and connections happened. But we could not have done this together without Ralph. So Ralph is our connector. He's also given a lot of his time. The coordination, the planning, the transportation was on him. He was our treasurer. He made sure that, the money we collected went to the right, places, and has really done a lot of work and continues to do a lot of work even in Kenya today. So let's give a hand to. We have a couple other people that didn't come. We have one girl that came with us. She's from Jamaica, but she came with us to Kenya, and she was able to be here today. And then we have Laura, who is American, who couldn't come also. She's from Philadelphia. Is that all? And Sharon from Indiana, who came with Juliana. So thank you guys. Just because of time, I won't give you the mic, but maybe later on when we have time, we can have them share their experience. I'd really like for them to also share how what they thought about the trip. So I'm just really going to just give you a little bit of a background on how all this started, and then I'm going to do my other presentation that I started yesterday later on, but I just want to really touch on a few things, and I'm not sure if we'll have time, but we may be able to have a discussion, because I really want more people to get involved in this. So I just titled this, "If you plan it, they will come." I'm telling you, if you just plan it and go, they will come. Which was a little overwhelming for us. We didn't know they would come in those big numbers. But I just wanted to give you a little background of how all this started. When I was going to school at Drexel University, there was a group of students, physician assistant students, and they just said, we would like to go do something over Christmas break. How about we go to Kenya? They asked me. I was like, oh, you want to go to Kenya? They said, yeah, sure, okay. Now I had this pastor in Kenya who had been telling me, oh, bring students to do work, to do a medical camp and all that. So it was a perfect opportunity. Connected those two, started planning it, and for Kenya, but Kenya kind of sounds like Kenny, Arise, so we left out the A. Our goal is to partner with Americans and Kenyans. So it is a partnership. NGOs, the government, individuals, and anyone really who is interested in partnering with us. Our vision is really just to provide healthcare, to provide clean environments, and to educate and empower communities. And what we have done so far is the healthcare part. Now, we partnered with Kako Inc. because Kako Inc. Has been around for a long, long time. Kako Inc. is an awesome organization. They actually pay school fees for kids who would otherwise not go to high school. And they've also, like during the drought, gone and given maize to people in Machakos. They've done a lot of other things. And their vision is to reduce poverty in Kenya. So it sounded like those two organizations were very similar in their vision and mission, and so it was a perfect partnership. And Kako Inc. is more developed. They know how to do things more than Kenny does, so it was very good for us to partner with them. This is under the leadership of Charles Ruff and Juliana for Kako Inc. So the medical camps that we've done, we did the first one in December 2011. Super successful. We went back in August 2013, and then this past January. And our goal is to partner with people in Kenya. We want to get to a point where Kenyans can do these medical camps without us. So we empower them to do this. So we don't take a truckload of doctors and nurses to go and do the work. We partner with the nurses and doctors and medical students and clinical officers and public health workers who are in Kenya. All we do really is provide the logistics and provide a forum for them to do what they do every day. And to date, since we started, we've seen more than 8,000 patients. And I'm telling you, we have seen lives. There are people that have come to the medical camp who, you look at this person and you're like, 1 more week, and you would not be here. We have saved life. We partner with the hospital so that if somebody is, if we have an emergency, they can be taken straight, to the district or provincial hospital. So what is it that we do? We do the general medical care. Really, it's the Kenyan providers that do this. Julia and I were too busy running around anyway. We barely touched a patient. And then, like Juliana said, all the other things we do. We also, every time we go do a service project. So we go like this, every time we went, except one time, we go to a children's home, we take some supplies to them, we have lunch with the kids, we jump rope and play ball with them and just love on them. And then the first time we went, we had a really cool project where we went to the Nakuru Provincial Hospital and we cleaned. We actually took Americans to go and clean, you know how those Kenyan hospitals are. But anyway, we cleaned, we cut the grass, we just cleaned the place, and then we visited our patients who were there. So, the planning, coordinating, and funding, I think somebody asked that question. It is a very tedious and long process. What we do is we create a committee for the place that we're going. So, the first thing we do, first of all, we decide on when we're going. So we're having a meeting today to decide where we're going next. So we decide where we're going. How do we select a site? There are 3 things that I look at when a site is proposed. Number 1, it has to have need. There has to be high need for these services. The first time we went, I made a plan, and one of the sites that we went to was not a very high need place, so we only had like 70 people that come out. There is so much that goes into planning this that if you take it to a place where there's not high need and you don't have that many people coming, you've worked so hard, but your return is not as great. So the second thing that we look at is it has to be a place where we know we will get a lot of numbers. We like a site where we're having, on average, 700 to 1,000 people that will show up every day. That's our goal. Just because it's a lot of work and we want to treat as many people as we can. And the third thing that I look at is there has to be people on the ground that are willing to work and support the project. So they usually form a committee at the location that we're going, and they start having meetings. We form a committee here, we start having meetings, and then we start doing conference calls so we can start the planning going. When you have this many people coming, if you're not organized, you know, it will be 3 o'clock and you're still trying to figure out where the pharmacy is going to be. Because you can imagine we go to a school or a church, like this last time we went, it was a church, we took all the chairs out, it became a hospital. We had the pharmacy in one corner, we have the eye person in that corner, we have the doctors sitting, we have people lined up. You can imagine you had like 200 people at a time coming in all day. So you have to have people who are lining people up, making sure that things are going quickly so you can see that many people. So there's a lot of coordination and planning that happens. Here's my philosophy, and some people don't like it in Kenya. My philosophy is, if we're having these people that you saw here, give them money, take their time and come to Kenya to do this work. If you're going to come to that medical camp as a Kenyan, you should not ask to be paid. So, I do not pay anything. If you must be paid, it means that we don't have the same philosophy, so don't come. And I'm very, you know, they keep telling me, if you don't pay them, they won't come. You won't have any doctors. You know, you'll have patients, you'll have doctors. Every time we've gone, people have come. Because there are people who want to help. And there are people who didn't come because they're looking for that 1,000 shillings a day. Because when other people do medical camps like Red Cross, they pay them. So my philosophy is that we do not pay anyone. If I had that money to pay somebody, I would rather take that 1,000 and give it to that mama sitting over there with a sick child than give it to this doctor who drove with his car and parked it over there and is coming to treat people. Does anybody agree with me?
Yes.
Okay. Thank you. I'm glad to see I have supporters because in Kenya, they're always waiting. Tunalipo. Hapana. Okay. So anyway, we give the volunteers chai Sunday, we give them lunch, we give them certificates that are very good for their CVs. We have a big dinner after to thank them. They get awards, we give them a little gift. So we give them something of value. And Charles can tell you a little bit more about that because he went through the whole thing also with his team. The other thing that I insist that we do is the medications must be bought in Kenya from a local pharmacy. So we don't take medicine from here. People who want to give us medicine, we prefer that they give us money and we go and take the business to Kenya. Okay. So this is, I just want to show you a flyer of the comedy show that we did. It was really fun. We raised some money. We'll be doing more of those. When we get time, I don't know if we have time now, but I would really like us to have a discussion as a team of how more of the diaspora can get involved in this. I would like to be able to take as many diaspora as I can every time I go. More than half of us that go should be us Kenyans that are going back to give back, joining with the other Kenyans back there and doing it, and then maybe at some point, because we go every like a year and a half to 2 years, maybe in between, we can support the Kenyans to do another medical camp. So they can see another, couple thousand people. So at some point, if you have any ideas or people, maybe you want to donate to our cause, or you know somebody who may donate, you can let us know. Or if you want to come, it's very satisfying. So want to give you that opportunity at some point today. And then just visit our websites to see what's going on. So anyway, this was going to be pictures, so maybe later on we can have some pictures for you, but Juliana already showed you some pictures. So I'm going to stop here.